Black Americans are more likely to experience serious psychological distress than white Americans. And yet, Black men seek mental health treatment at significantly lower rates than most other demographic groups. So, what happens to the weight that never gets put down? In our last episode, we looked at marriage and relationships. We talked about partnership, family formation, and the economic and social realities that shape how Black men move through intimate life. Relationships carry weight, work carries weight, family responsibilities carry weight, expectations carry weight, and for many Black men, that weight is carried largely in silence, not because they do not feel it, because they were often taught that feeling it, and especially talking about it, is something they cannot afford to do. This episode is about what that costs. According to the U.S. Department of Health and Human Services, Black Americans experience serious psychological distress at higher rates than white Americans. Depression affects Black communities, anxiety affects Black communities, stress affects Black communities. But mental health challenges among Black men are often underdiagnosed and undertreated. Researchers have found that Black men are less likely to receive a diagnosis for depression even when experiencing similar symptoms. Part of the reason is access. Part of the reason is stigma. And part of the reason is how distress is expressed and understood. Anxiety disorders affect Black Americans at rates comparable to other populations. But the sources of that anxiety are often layered: financial pressure, family responsibility, workplace stress, exposure to discrimination, community violence, chronic uncertainty. The American Psychological Association has documented the effects of race-based stress and discrimination on long-term mental and physical health. Chronic stress affects the body, the mind, and the nervous system. The suicide data may be the most urgent statistic in this episode. Suicide rates among Black males have increased significantly over the past 2 decades. Among Black boys, the increase has been especially alarming. What was once considered a relatively low-risk population for suicide is now experiencing one of the fastest-growing public health concerns in the country. Mental health treatment presents another challenge. Only a fraction of Black adults who need mental health care actually receive it. Among Black men, treatment utilization rates remain particularly low. Researchers consistently identify several barriers: cost, access, stigma, lack of insurance, lack of culturally responsive providers, and mistrust of healthcare systems. Therapist representation matters too. Only a small percentage of licensed psychologists in the United States identify as Black. That shortage can make it more difficult for Black men to find providers who understand the cultural context surrounding their experiences. The conversation is not simply about availability, it is also about connection, trust, and feeling understood. So, what do these numbers tell us? The first thing they tell us is that there is a gap between distress and treatment, a gap between what is being experienced and what is being addressed. And that gap has consequences. Mental health does not exist in isolation. It affects relationships, parenting, employment, physical health, decision-making, and quality of life. The second thing the data tells us is that the stigma surrounding mental health remains powerful. Many Black men have been taught that strength means endurance, that resilience means silence, that vulnerability is dangerous. Those beliefs do not emerge from nowhere. They are often rooted in history, culture, survival, and lived experience. The third thing the numbers tell us is that access matters. Treatment is not simply about willingness, it is about affordability, availability, trust, representation, and whether people believe help exists for them in the first place. The suicide data forces us to confront something difficult. Silence has consequences, and when conversations about mental health are absent, people often carry burdens alone. But here is what the numbers cannot tell you. They cannot tell you about the Black man who has never once been asked how he is doing and genuinely believed nobody wanted the real answer. They cannot tell you about the man who learned early that pain was something to be managed privately, something to hide, something to survive. They cannot tell you about the grief that was never processed, the losses that were never discussed, the disappointments that were never acknowledged, the trauma that was absorbed because there was no safe place to put it. They cannot tell you about the father trying to remain strong for everyone around him while quietly falling apart himself. They cannot tell you about the son who became the emotional support system for everyone else and never learned how to ask for support in return. They cannot tell you about the cultural messages passed down through generations, messages that sometimes began as survival strategies, messages that protected people in difficult circumstances, messages that later became cages. Many Black men were not taught how to process emotions. They were taught how to survive them. And surviving is not the same thing as healing. This conversation is not about weakness. It is not about pathology. And it is not about reducing Black men to struggle. It is about recognizing what happens when an entire group of people is expected to carry extraordinary weight while receiving limited permission to put it down. Emotional strength is real, resilience is real, perseverance is real, but strength without release is not strength forever. Eventually, it becomes pressure, and pressure always looks for somewhere to go. Before we continue, I want to leave you with a question. What does emotional strength actually mean? Is it the ability to feel nothing, or is it the courage to feel everything and keep moving forward anyway? And what would change if Black men were given and gave themselves permission to not be okay? Mental health and physical health are often more connected than we realize. Stress does not stay in the mind. Trauma does not stay in the mind. Burnout does not stay in the mind. Eventually, they show up in the body. In our next episode, we look at physical health, life expectancy, heart disease, diabetes, preventative care, and the question of what factors influence long-term health beyond personal choices. This series is designed to encourage understanding, not agreement. The statistics discussed in this episode and the sources used to obtain them are available below. If this conversation made you think differently about the topic, continue with episode 9 as we explore the next chapter in the story. Because understanding begins long before conclusions do.